Today we have a selection of frequently asked LDN questions submitted by our members. They are answered by our medical advisors and medical members. Any LDN questions you may have, please email linda@ldnrt.org.
Hi, I'm Dr. Livingood, practicing in Arizona in the United States. All my patients want to know, how do I know if I'm on the right dose of LDN? I hear this question so frequently that I've adjusted my prescribing method to answer this question. First, I start all my patients at quite a low dose, somewhere between 0.5 and 1.5 milligrams, depending on the person. And then as we taper up each week or two, timing again depending on the person, I ask them to check in with me briefly and provide the following information. First, I want them to know if they feel any benefits at all, even a general sense of positivity or well-being. And this is usually the first sign that we will have favorable results and that they're reacting positively to the medicine. And I also give them a personalized list of symptoms or items to monitor in order to measure the target benefits. So some examples are following lab markers, monitoring the necessity of other medications, which often goes down, or using a scale to measure pain levels. And then secondly, I ask them to watch for unwanted side effects, such as disturbed sleep. If that occurs, I move the dose to the morning and try again at the same dose, and then continue on from there, tapering up. The ideal dose is a sweet spot with measurable perceived benefits and no side effects. So while this is different for everyone, in my practice, it most often falls between 1.5 and 4.5 milligrams.
Hi, my name is J.P. Salibi. I am a functional medicine physician, and I also sit on the medical advisory board for the LDN Research Trust. Does LDN treat persistently high levels of Epstein-Barr virus? The answer is that LDN has been used to treat EBV, or Epstein-Barr virus, reactivation illness, that has fatigue and other symptoms as part of the disorder. The British Medical Journal, as recent as January 2020, published 3 case reports, all with positive effects on the use of LDN as a therapy in chronic fatigue associated with EBV. Can LDN help pernicious anemia? The answer is, pernicious anemia is classified as an autoimmune disorder where there is a deficiency in vitamin B12 due to atrophic gastritis or the loss of parietal cell activity that generates or produces intrinsic factor, or IF. IF is necessary for the proper absorption and assimilation of vitamin B12 taken orally. LDN has a powerful history for helping with autoimmune, or AI, disorders across the board. The use of LDN may be helpful, but this has not been studied very well, and there are a paucity of medical journal articles on this subject. Can LDN cause reactivation of viruses, yeast infections, or EBV, etc.? The answer is that I am not aware or have heard of such a thing, nor experienced any of this in my clinical practice. I have, however, seen the Herxheimer reaction, or herxing, as it is named for short, occur with some of my Lyme patients in the beginning of the use of LDN. I am, however, not aware of any cases of EBV, other viruses, or any kind of yeast infection reactivation with LDN. Can LDN help with nasal polyps? The answer: I have never used LDN for nasal polyps, but I also do not see very many patients with this nasal condition. I am not an ENT, so therefore this is a very rare occurrence in my practice. I am not aware of any published studies on the use of LDN either orally or used topically for this condition, but I am aware of a clinical trial still in the recruiting stage, stage 2, at the University of Pennsylvania, that has nasal polyposis as an inclusion criteria for this study.
Should I take LDN on empty stomach? Answered by Dr. Nasha Winters, read by computer. I haven't found an empty or full stomach to be an issue. Many patients take this medication at bedtime, after dinner, or others first thing in the morning, even with breakfast, if not in a fasted state. From experimenting on myself and getting feedback from other patients and clinicians, there is no rule of with or without food with regards to taking LDN. How do you take low-dose naltrexone, LDN, with opioids? Answered by Dr. Nasha Winters, read by computer. I am not an expert on this particular topic, but do have colleagues that are. In general, unless you are well trained in this arena, do not mix the two. The LDN will block the opiate medication from doing its job, and breakthrough pain can be devastating. Unless you have been trained by an expert in how to use the extreme low dosing of LDN to help slowly wean off an opiate, do not attempt this on your own or with an unseasoned provider. Can low-dose naltrexone, LDN, be taken with tramadol? Answered by Dr. Nasha Winters, read by computer. I have had plenty of folks combine these two. I just advise to keep them at least 4 hours apart. Does low-dose naltrexone, LDN, cause an increase or decrease in cranial pressure? Answered by Dr. Nasha Winters, read by computer. As someone that works with primary and metastatic brain cancer, I have found LDN very helpful in overcoming intracranial pressure/edema, as it directly lowers inflammation in the brain, so in my personal experience, I would say it decreases intracranial pressure. Can low-dose naltrexone, LDN, be used for patients with G6PD deficiency? Answered by Dr. Nasha Winters, read by computer. Yes. No issue there. A test showed that my genotype may impact LDN's mechanism of action, and result in reduced efficacy. Will a higher dose work better? Answered by Dr. Pamela Smith, read by computer. No. Low-dose naltrexone is true to its name. It is low dose. Larger doses change the mechanism of action. Are hot flushes a side effect of starting LDN? Answered by Dr. Pamela Smith, read by computer. Hot flushes are not usually a side effect of LDN. The most common reason for hot flushes is cortisol, the stress hormone, not being normal. You can try lowering the dose of LDN to see if the hot flushes improve. You should know within 2 weeks if this is the cause of the problem. If stress is the cause of the hot flushes, it can take more than a year to resolve the hot flushes. Stress reduction techniques and adaptogenic herbs, such as rhodiola, work well for the stress. Will LDN show up on an analgesic combinatorial pharmacogenomic test? Answered by Dr. Pamela Smith, read by computer. Not usually. It does depend on how sensitive the test is. Can low-dose naltrexone, LDN, help lower cholesterol? Answered by Dr. Jill Cottell, read by computer. In the past, I actually did put a patient on LDN for dyslipidemia because their LDL particle number was high with signs of inflammation. In that instance, it did not make any difference in the lab values. Does low-dose naltrexone, LDN, raise cortisol? Answered by Dr. Jill Cottell, read by computer. I can't think of any reason why LDN might raise cortisol. I would guess that it wouldn't, but that would only be speculation, as I've never had any reason to measure it on a patient taking LDN. Is endorphins deficiency a real thing? Answered by Dr. Jill Cottell, read by computer. Yes, endorphin deficiency is a real thing. This goes all the way back to Dr. Bihari's work in the 1980s, when he first discovered low endorphin levels in patients with autoimmune disorders. Can low-dose naltrexone, LDN, stop working over time? Answered by Dr. Leonard Weinstock, read by computer. I have not seen this. Some doctors have said that it can occur. They stop the low-dose naltrexone, LDN, for a week and restart it. Can low-dose naltrexone, LDN, block mast cells, and stop the release of histamine? Answered by Dr. Leonard Weinstock, read by computer. There are no studies, but my theory is that low-dose naltrexone, LDN, decreases T-cell activity, and T-cells definitely activate mast cells. In addition of antibodies also can activate mast cells, and low-dose naltrexone, LDN, reduces B-cell activity and hence could reduce antibody-stimulated mast cell activity. What happens if you need emergency pain relief while on low-dose naltrexone, LDN? Answered by Dr. Leonard Weinstock, read by computer. Low-dose naltrexone, LDN, lasts for 4 to 6 hours. If you need pain relief during that time, then a higher dose will likely be required.
This is Dr. Deanna Windham. I'm answering the question, does low-dose naltrexone improve mood? Absolutely yes, it does. Low-dose naltrexone increases your body's natural production of endorphins, which are your feel-good hormones. There is also some evidence to indicate that neurotransmitter levels in the brain are improved while taking LDN. However, LDN is not a panacea for mood disorders. There is work that needs to be done just like with any chronic disease. LDN works well in combination with other lifestyle and integrative approaches to improve or resolve mood issues. This is Dr. Deanna Windham answering the question, why does titrating up LDN too fast cause nausea? I have not seen this very often in my patients at all. When I have, it has most often been in patients who have microbiome imbalance or other gastrointestinal problems. The microbiome is your bacteria that are alive in your gut. It can also be due to medication interactions or hormone imbalances. Again, this is a case in which evaluation and management with a practitioner familiar with LDN would be very helpful or even essential. This is Dr. Windham answering the question, if LDN makes you feel anxious, what can you do? First of all, some of the top reasons this might happen is due to medication interactions, especially with opioid medications or psychoactive prescriptions such as antidepressants and anti-anxiety medications. Another reason is underlying psychological issues such as depression, bipolar disorder, etc., or an imbalance in the gastrointestinal or endocrine systems. For these reasons, it is imperative to work with your prescriber to accurately diagnose and treat this relatively uncommon side effect. You can try 5-HTP, lithium orotate, magnesium citrate, or GABA, G-A-B-A, to help with symptoms. But you must take care if you are on an antidepressant or other psychoactive medications that this isn't an indication of an interaction. You can also try homeopathic remedies such as Calm Forte or Rescue Remedy, which would be safer with prescription medications. You should also be taking vitamin D3, but this won't work right away as it takes time to build up in your system.
Is it safe to take LDN with Gillenia, immunosuppressant? Answered by pharmacist Stephen Dickson, read by computer. If the patient is stabilized on one drug first, then it is usually safe to take both together. In fact, quite a large number of our patients do. Make sure you are stable for at least 3 months on one before adding the other. Should we take LDN same time as antipsychotic medications or at different times? Answered by pharmacist Stephen Dickson, read by computer. Doesn't make any difference.
Any questions or comments you may have, please email me, Linda, Linda, at ldnrt.org. I look forward to hearing from you. Thank you for joining us today. We really appreciated your company. Until next time, stay safe and keep well.